Alrighty, looks like we are ready to rock and roll. So today we're going to be doing a little hip stretch action. We're going to be stretching out the quads and hip flexors. You don't need anything, literally anything. You can just be on the floor. We're going to be making sure that the quadriceps muscle group allows knee flexion. We're also going to make sure it allows for hip extension. We're also going to talk about hip osteoarthritis and the idea of fixing hip pain from hip arthritis forever, because it's an idea that a lot of people have when they have hip pain, and it's a question that people have when they have back pain, shoulder pain too, right? Like, can I fix this forever? Is this exercise regimen actually going to fix the root problem, or do I really just need surgery to fix this forever? Okay, so we'll get to that after we go through the exercise. So a couple weeks ago I showed you some good quad and hip flexor stretches you can do against a wall. I encourage you to go check that live stream out from last week, 2 weeks ago. Today we don't even need a wall. So what we're going to do is you're going to be sitting on the floor. Some of you are going to find that it's extremely difficult to even sit straight up like this because you got some gnarly, tough stuff in there. So just get as close to this as you can. Okay, you don't need to get super straight up. You be here, you have this knee bent, you're going to grab the shin or the ankle, whatever you can reach. If for some reason you are so stiff and tight that you're like this and you can't even reach, then you might need something. You might need something like a strap or a grappling hook gun to get that over there. Put that on there, and you're going to just pull to bring your foot closer to your butt. Okay? If this is not enough of a stretch for you, then you have two options. So let me turn so you can see. You can pull the butt closer and closer into your, sorry, not your butt, pull your foot closer and closer to your butt, which is going to increase the stretch on the quadriceps. Or you could think about really squeezing the butt cheek, pushing the pelvis forward more so that this angle between your thigh and your pelvis and your torso opens up more. So for example, if I wanted to go to a more closed angle on this, if I were like this, right? When I stretch the quads, when I bend the knee and stretch the quads, this doesn't feel like much because the hip angle here is closed down, right? That's not maximum stretch on the quadriceps. If I open that up, that starts becoming more of a stretch, okay? And when you're pushing the hips forward, squeezing this glute, that's putting just that extra little bit of tension onto the front of your hips, all right? So that's that. If you want to increase it more, you've got, I guess we'll call it a third option. So I'm pulling it here, or I'm just grabbing it with my hand. This third option is to start to lower yourself down closer to the floor. So now you're getting the thigh bone more in line with the rest of your body. So why does this change things? Well, when you're sitting up like this, or you're close to sitting up like this, you're actually adding a little bit of that hip flexion that we talked about. We're closing down this front angle a little bit because it's highly unlikely that you're going into basically a half split. So you're here. Once you start to come down, that starts putting the thigh bone in line with the rest of your body and helps you get more pure hip extension. Okay, so if I hold, I'm up here, I can reach my shin, my ankle, I start coming down, and then I get that stretch. When I want more, I keep holding on, and I keep going down, and I keep thinking about keeping this hip, this whole area open, right? I don't close it down this way as I fall down because now I'm losing the stretch. I'm keeping this all open as I come down, and I'm feeling the stretch through the quads. If I squeeze my glutes, and I think about pulling the knee back, pulling the thigh back that way, squeezing the glute, push the hips forward, pull the leg back, I'm getting even more stretch. And if I want to keep it, if I keep that knee lower, depending on your flexibility and your geometry, this may or may not work, but if I can keep my foot anchored on the pad, let me show you this, keep my foot anchored on there, then as I go down, I can do essentially a wall quad stretch, except I'm just using the floor, or boom, my hand, and then I can really focus on feeling this fire, this stuff stretch out. And then once this starts feeling easy, you could just transition this to the wall. So the reason I'm showing you all this is because, number one, a lot of times when you're thinking, I want to do a quad stretch, you're like, okay, I need to find a couch or a wall or whatever. Or when you go to stand and do a quad stretch, you're just too unstable and unbalanced, or you cheat way out here like that. So doing it on the floor gives you a simple, easy option that you can do at home, at the gym, in the grass somewhere, super simple. You just sit down, grab, and go. And the other reason is when you are doing this against the wall, or you're doing this on the couch, it can get really intense really fast, and I feel like it's often quite easy for people to start cheating. So let me back this up and hope you can still see me on camera. Once you start doing this on the wall, sometimes people will get real aggressive. I know I've done this. You'll get super aggressive, you'll go up, and as you're doing that, you're kind of like allowing this abduction to happen. And it's a good stretch, it's not wrong, but it's also cheating, right? So you're missing that angle where the thigh bone is actually in line with your body. So highly recommend playing around with this option if you've ever had trouble with your quad stretch before. And of course, you want to do this on both sides. About a minute to 2 minutes when you're doing these stretches. And you should definitely do them at least twice if you can on each leg. But, you know, it's your life. You do what you want to do. And of course, when you start off, listen to your body, please. If it feels like you're hurting your knee, if it feels like something is pinching or jamming somewhere, you're probably being too aggressive with it, so you need to back off, lower the intensity. So if you're doing it here and you start to pull and you feel like your knee is going to explode, you've pulled too far. So don't go that far. If you start lowering yourself down and it feels like there's pinching and jamming somewhere, you're probably not doing it in the healthiest possible way, right? So those are all the tips, highlights for that exercise. I am going to include this in a workout, a follow-along workout that should be coming, I think, next week. That's going to help with, especially with people who have that hip impingement diagnosis where you can't bring your knee towards your chest. We're going to be doing that gentle stretch as well as some of this to help open you up, because when you're working on increasing your hip flexion, this stuff can start feeling really jammed up. And you do need to stretch it back open so that you have a nice balanced functioning hip joint. So hopefully that makes sense. If you have questions about what I've just talked about, drop them in the chat. It's been surprisingly quiet on today's chat. Let me know where you're watching from, and let me know if you have questions about any of this or other questions that hopefully I can answer at the end of this video. Now, in our agenda today is hip osteoarthritis. So really interesting study to talk about today, and also just some interesting philosophical things to think about. So when you think about hip osteoarthritis, talk about hip pain, many of us, if not all of us, tend to think of hip osteoarthritis as this one solid, simple idea of, well, if you have bone damage or cartilage damage, that equals hip pain. That is hip arthritis. I think that's how most people conceptualize all this. Really interesting studies have been done over the last couple of decades. I talked about one that I believe was from 2009 before, but today there's one from 2015 that corroborates what we talked about in that previous study. So today is actually, oh no, where'd it go? So interesting. So they basically looked at how many thousands of people? Oh my goodness. Where did you go? Bear with me. Okay, here we go. It's from the, yeah, here we go. Here it is. Here it is. So it's from 2015 from the BMJ. Not to be confused with the WWF. So in this study, they looked at the relationship between, I will provide a link actually in the chat and in the description box after we're all done with this. So I just dropped the link in the chat. So in this study, they looked at a bunch of people's hips. Where is it? Okay, 4,366 hips. Okay, so they looked at the relationship between X-rays of people's hips, an internal rotation test, and presence of hip pain generally, and presence of hip pain during that internal rotation test. And what they found was that there was absolutely no correlation between what was found on X-ray of your hips and any of these other factors. So reading from their conclusion, they actually say hip pain is discordant with radiographic hip osteoarthritis. We showed that pain was not present in many hips with evidence of osteoarthritis on radiography, and many painful hips did not show radiographic evidence of hip osteoarthritis. Most older participants highly suspected of having clinical hip osteoarthritis, both groin or anterior pain and or painful internal rotation, did not have radiographic hip osteoarthritis, suggesting that many older people with hip osteoarthritis might be missed if diagnosticians relied on hip radiographs. Hip osteoarthritis is common in older people with various comorbidities and blah, 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 has major public health cost burdens. Therefore, health professionals should continue to evaluate and treat patients with hip pain suggestive of osteoarthritis despite negative radiographic findings. So there's a lot to unpack there, and I actually had to ask the internet and ChatGPT and myself, what does this mean? And so to break it down, there's from what they're saying, there's basically two different categories or ideas of osteoarthritis. There's clinical osteoarthritis, where you're showing symptoms. You have hip pain, movements are painful, you feel weakness, you feel crunching, cracking, whatever. It's basically like what's presenting as discomfort and not fun times in your hips, okay? So clinical OA, clinical osteoarthritis is, yeah, look, his hips hurt. Radiographic osteoarthritis is you look at the X-ray and you say, yep, there's the damage. There's the cartilage damage, there's the bone damage, whatever. In this study, as in previous studies, the relationship between the radiographic images, findings, and the clinical findings is non-existent. They are discordant, meaning they just don't seem to be related. Sometimes they seem to be completely contradictory. So you have to ask, well, what do you do with this, right? If you could have really bad hips on a radiograph, which previous studies, and I'm sure there's probably another more recent study, has shown that that you can have these bad bone-on-bone situations and no pain, or you could have really severe pain and no bone damage. How do you make decisions? What should you do? What's the most intelligent thing you could possibly do to fix this? Well, surprisingly, as I was doing research, I came across recommendations from the 2019 American College of Rheumatology / Arthritis Foundation Guidelines for the Management of Osteoarthritis. What do you think it is? What do you think one of the strongest recommendations for patients with hip osteoarthritis is? The strongest recommendation is not surgery right away. Okay. The strongest recommendation, exercise. Exercise is strongly recommended for patients with knee, hip, and or hand osteoarthritis. Okay, they go in, oh, I'll drop this link into the chat and also drop it into the description box when we're done with this. Okay, so even the authorities, the powers that be, are starting to see that exercise makes a really big difference to your quality of life if you have a painful hip joint. Okay? There are some really interesting details in that document that you should read when you have time. But the big takeaway is find an exercise path, some strategy that helps you as an individual, seems to fit well for you, that you can afford and that you can stick to. Those are the main points. There's all kinds of different things you can do for your hips. Find what seems to work for you. Okay? Now, the big question that comes up for a lot of people is, well, what if I have this diagnosis, whether it's impingement, arthritis, whatever, and I do exercise and it feels better, and it comes back? Doesn't that mean that doesn't it mean that my problem is something that needs surgery? Because if I have to do something to maintain the comfort levels, it means that there's a deeper problem. This happens also for people with back pain and shoulder pain, right? They're like, well, if I have to keep stretching and exercising, then it means my spine is damaged. So even if I exercise, I still need surgery, right? So I want you to think about this slightly differently. Currently, I can do push-ups. I'm not going to do them for you right now. I don't want to have to prove this, but I can do push-ups. But if I stopped doing push-ups, do you think I would be able to do push-ups in 10 years? Just think about how muscles work. Okay, so today I can do push-ups, but I'm going to stop doing push-ups for years. Oh no, somebody says can't hear. Please tell me you can hear me. I hope your audio is working. Everybody else, please let me know that you can hear me. And then hello Shannon. Hello Momo in Mexico. Hello Medrim5. I'm glad you can hear me. All right, SpyMain, maybe you have me muted. Or maybe your Bluetooth headphones are not connected. Thank goodness. All right, so again, back to the push-ups. If you stop using muscles, if I stop using the muscles that make a push-up possible, a push-up is going to be uncomfortable or impossible. In the same way, squats. Right now I can go into a deep squat position. It's not a big deal, doesn't hurt me. Cool. I can stand up from this position. Why? Because the muscles that control that motion, they're used to it. However, I can tell you from personal experience, when I wasn't doing this a lot, when my legs and hips and feet and ankles got really weak back in my 20s, this was not possible. It was painful. And then there was a time in my 30s where I lost the ability to go to the deep squat also. and it was painful, it was difficult, my hips would feel really weird, I get some weird pops and cracks, things would feel not so good in the knees. So what's that mean? Did that mean that my hips were permanently damaged? Did that mean that my knees were permanently damaged? No. What it meant was the movements available are a function of the movements that I practice. Or, put another way, use it or lose it. If you don't have the muscle, if you don't make the muscles or encourage the muscles to master a certain position, master a certain motion, you will lose that motion. And with any motion, if you suddenly are loading muscles or joints in ways that they're not prepared for, they can absolutely be painful. So when you start thinking about fixing back pain, fixing hip pain, knee pain, shoulder pain, it's important to realize that if the act of standing, sitting, or walking, if those different things hurt, that doesn't necessarily mean you have some sort of permanent damage situation. It means that currently your body doesn't know how to handle that specific motion, that specific pattern of movement. So can you fix then hip osteoarthritis permanently? People will think, when they think of fixing their hip pain permanently, they think, I'm going to do this one thing once. Like, I'm going to get a surgery once, and it's going to fix the problem forever. That's the promise. I think what people underappreciate is that there are certain consequences to choices like a surgery, right? Which I'll get to in a second. If we just stick to exercise, let's be perfectly clear with this. Exercise can never make muscles grow and last forever based on one time, 1 month, even 1 year of training. So, just like with the push-ups, even though I've been able to do push-ups for many, many years, if I stop doing them, it's not like I get to keep my push-up ability permanently. It requires upkeep. There's no way around it. So if your hip pain or back or shoulder pain gets better from doing stretches and exercises, it can still get worse if you stop. And that doesn't mean that you're permanently broken, damaged, deformed, or whatever. It's so important to get that clear. Because otherwise, you start doing exercise and stretching, you feel better, and then you get lazy about it, which everybody does, so don't feel bad if you've done that. Everybody does that, and then what happens? You start feeling that gnawing pain again, right? You start feeling something go wrong again, and then you start thinking, oh, well, if it came back, maybe I really do need that surgery. But what that's telling you is you need to keep doing more of the good stuff and figure out what the bad stuff is. Do the good stuff, figure out what's holding you back. I'll give you a personal example. For me, in the last couple of months, I realized, oh, I sit at the computer editing videos. I sit on a surfboard. When I surf, I'm constantly turning this way, and this leg's doing something very different from this leg. This hip and low back started to feel real bad after like 4 or 5 years of constant surfing and sitting at the computer and not properly training, okay? And I realized, oh, I need to adjust my whole life in order to fix this problem. Because, yeah, my hip hurts, my back hurts. I'm not going to tolerate that for very long, right? And once the pain gets bad enough, you really have to pay attention. So for me, it was like, okay, well, this is the sign I need to actually get back to training, get back to balance, get back to really focusing on keeping the body in good muscular balance, side to side, and in so many different motions. Okay? So, I had terrible hip pain when I was in my 20s, made it get better, went back to playing hockey, enjoyed that a lot for a while, and then until I didn't enjoy it anymore, and also until I felt like the upkeep cost, the training cost to make ice hockey goalie possible just wasn't worth it anymore for the stress levels and the amount of time and invested time going to a rink and all that stuff, right? Like it just wasn't worth it. So once I put the time and attention to my hips, to my body, it got better, right? The fact that the pain came back after doing a lot of surfing and a lot of neglect for my body doesn't mean that I'm permanently broken. It means I was not treating my body properly. And now that I'm training properly and building things back up, I feel a whole lot better. I'm doing all kinds of crazy things now. Gonna try doing a handspring sometime soon, I think. All right, and I guess if I manage to do that without breaking my neck or anything else, I might post it on my Patreon page or somewhere. Maybe I'll post it on YouTube. Who knows? In any case, going back to surgery, I think something that is underappreciated, especially for people who go into getting hip replacements. I had a number of clients over the years who had hip replacements. When you get a surgery done, there is usually a loss of range of motion. If you think of like spine surgery, like spinal fusions, there's clearly a loss of motion wherever things have been fused. With hip replacement surgeries, you lose range of motion. Depending on which way they cut into you, you're going to lose certain ranges for quite a while, if not forever. And one thing to think about there is when you are experiencing hip pain, for many people, you experience pain when you go into certain ranges or you're in certain positions. And when you've now gone in and altered your original equipment and blocked certain ranges, you may very well feel better, right? I'm not going to argue that some people, like it's clear, some people feel better at least for a while. Some people may feel better for the rest of their lives. It's possible. However, there are some people for whom that is not the case. They do these surgeries, they don't get better, and they've lost the range of motion. I would also submit that some people will do the surgeries, they lose the range of motion, and because they've lost the range of motion, or because they have now pulled back on the things that they were doing, they no longer experience the pain and discomfort that their previous activity level might have been creating. Also, the whole act of going in and cutting muscles and messing around in there and then sawing a piece of bone off, whatever, doing all that stuff, pulling the whole thigh bone out of the socket affects all the muscles around the hip joint. All of that could potentially reset, in the best case scenario, maybe rebalance or just recalibrate what the brain expects and thus make things less painful. But pain science is like a crazy, crazy complex world, so nobody really knows what's going on there. The big takeaway for me that I think people should think about is surgery has some potentially rare, but potentially very big downside risks. Exercise, as this American College of Rheumatology and Arthritis Foundation recommendations point out, exercise has basically no downsides. It can be very cheap and affordable. It can be very, very effective as long as it is done consistently and helps you in your specific way. So that's some food for thought for all of you out there who are dealing with hip pain, who are thinking, can I fix my hip pain forever? think my answer to you is you can fix your hip pain. You're not going to fix it forever by doing one thing once. You're going to make your hips feel better by using your hips, by teaching them how to move, by training them, by using the muscles in unique ways that modern life usually doesn't have us do. I mean, for a lot of people in the Western world, just sitting on the floor is already a crazy thing. Even for men in the Western world, just being able to sit like this or this can be a challenge. And if that's the case for you, I would just invite you to think, what would my life be like if I could sit cross-legged? What would my life be like if I could do this? What would my life be like if I could stand up straight and not stooped over all the time? Those are all indicative of hip muscle issues, not of you being genetically malformed or genetically predetermined to be malformed in some way. So, I invite you to take the advice given here, exercise, and see what happens. All right, so I'm just going to take a quick look at some of the questions. Jackie Delaney, hello from the UK. Hey there, diagnosed with bone-on-bone hip arthritis. Been watching your videos, hanging in there. Well, awesome, Jackie. I hope you find something helpful in these videos. I hope you definitely check out some of the follow-along workouts I have on YouTube and do them, try them. The stretching, the strengthening, do not neglect strength work. Do what your body feels like it needs, and hopefully it helps. With bone on bone, again, there have been multiple studies showing that you can have bone on bone and no symptoms, which is honestly shocking to me. But also, if at some point in your life you feel like, you know what, nothing is getting better and I've literally tried every kind of exercise possible, which is a hard thing to do, but if you feel like your body needs something more, then you do what you feel you need to do. Okay? I did make a video a while ago about I believe it was a woman who had like crazy bone-on-bone arthritis where she had a chunked out portion of her femoral head had like collapsed, and then it was like stuck on the edge of the socket. But she had no hip pain. She only had back pain, and she had to shop around, I think through like 10 or 11 different hip surgeons, because all of them said, everybody was saying, if it doesn't hurt, we're not going to operate. Until she could finally find one who was like, yeah, all right, we'll try it. So it's a crazy world out there. I don't really know how anyone makes these decisions, but keep exercising, keep seeing what happens. See what you can learn about your body. There's a crazy amount of different options for your hips. So I hope that's helpful for you in some way. Hello in Bulgaria. All right, so close again. Hey there. And then, all right, Annie the super nanny. My hip pain is worse at night sleeping on my side, and I'm a side sleeper, so it interrupts my sleep all the time. I've got 2 videos on YouTube already. If you just look up upright health side sleeping, I think, or hip pain at night sleeping upright health, I've got 2 videos on that. One of them is the explanatory video showing you the exercises. Another is a follow along. So if you haven't watched those are some of my most popular videos because they work. I feel your pain. I used to have really awful hip pain sleeping on my side, and I hope those videos help you as much as they have helped the thousands of other people who have watched those videos. Hope that helps. All right, last one. Katie A, what are the top exercises? I do yoga 4 days a week, Pilates and aerobics, and my right hip is more painful. Okay, so the most important exercises is I'm trying to distill this into the shortest possible answer. It depends on your starting level of flexibility and the activities you're already involved in. If you're already a really, really flexible person, Generally, this applies to women, especially if they did dance or gymnastics when they were younger. It's really, really important to strengthen things in a lot of different positions. Not just straightforward, definitely not just flexion. And if you're one of those really flexible people, using load, using weights can be extremely important. So yoga and Pilates can be really good. I have seen, however, some people get into situations where they are no longer balanced because they're doing those, and maybe because of how they train with Pilates. I'm not bashing Pilates. I'm not saying there's any perfect exercise system out there that hits everything. I'm just saying you should look at your body and say, where am I missing muscle and where am I missing strength? Is something not balanced front to back or side to side? With a lot of yoga and Pilates teachers and practitioners, I've often seen that their butts, their hamstrings can be undertrained relative to their hip flexors. They spend a relatively high amount of time in hip flexion and not a lot in loaded hip extension. The great thing with Pilates though is you have all those really cool, interesting holds you could be doing with resistance in really nice open positions or challenging awkward positions. So depending on how you're practicing it, it could be maybe you don't need certain areas, but you might need these others. So I can't tell you what your top exercises are. And then if you are an athletic male or athletic woman who is lifting a lot of weight, or you're just one of those body types that's just like beefy, meaty, really good at creating force, but not so good at lengthening, then you might need to do other things, right? You might need to be stretching more. You might need to massage things more. Always keeping in mind balance, right? How do I balance out the attributes that I have? Because, you know, if you can bicep curl 100-pound dumbbells, but you can't straighten your elbow, like, it's like an easy win to maybe learn how to straighten your elbow. In the same way, if you can deadlift 600 pounds, but you can't touch your toes, it's like a clear signal to you, like, hey, your function in one arena is fantastic, but you can't do a basic thing that you would need to do to survive in a non-technologically advanced society, right? Like if you can't bend over to touch your toes, you can't pull something out of the ground because you're so stiff and tight, it's not great. So I hope that answers your question. I don't believe there's any like this is the best exercise ever. I did just see a video on YouTube, I think yesterday or today, where some chiropractor was saying this one hip exercise strengthens every hip muscle. And I was just like, no, it doesn't. It really doesn't. There's no such. No such. It got me to click. And then the exercise definitely does not hit every hip muscle. There's just no such exercise because your hip muscles are complicated. They wrap all around the joint from many different positions and end at all kinds of weird angles. In order to train all your hip muscles, you got to train a lot of different motions, and that requires time, attention, patience, and exploration. So there's a lot to learn, and as you learn it, feel what your body can do. It can be extremely empowering, and it can be very healing. So I invite you to go on that journey, whether it's with my videos or somebody else's videos. You should embark on that journey. If you've got hip pain, hip arthritis, exercise. I'm saying it, even doctors are saying now. So like, there's no argument. You should start using exercise to heal your hips. It'll help you feel better. On the screen, I think you'll already have seen the Healthy Hips program, uprighthealth.com/HH. Check that out whenever it feels like the time for you. Otherwise, I've got tons of free videos about hip pain on this channel. Just type in hip pain, upright health in the YouTube search bar. You will find plenty of content to help you. And I hope it does help you. If you want exclusive content, special podcast episodes, weird garage thoughts, you can find all that on Patreon at patreon.com/uprighthealth. I really appreciate you being here, everybody who's been here with me from wherever you are. Some of you all over the world. I appreciate you watching. I appreciate your support, your likes, your subscribes, all that good stuff. Thank you so much. And as always, I hope you guys remember that pain sucks, life shouldn't.